Today is World Health Day. Join us as Dr. Laz speaks on how to make our hospital work.
Good morning. Thanks for having me here.
Okay, now let me even start with the fact that, with how to make our hospitals work. Why how to make our hospitals work?
Thank you very much. Yes, How to Make Our Hospitals Work is a book that came out of some experiences I've had in the last few years, leading advocacies for health system strengthening, and also as a public health practitioner that I've participated in a number of interventions aimed at strengthening the health sector in the last decade. So, and it's a book that anybody could read, because one of the things that we are pushing at the Make Our Hospital Work campaign is that citizens themselves, can begin to take actions. Because when you look at our national health policies, the National Health Act 2014, and also the National Health Policy, the World Health Systems Policy of the National Primary Healthcare Development Agency, the National Health Insurance Authority Act, the National Health Promotion Policy of the Federal Ministry of Health. There are so many of them. There are always parts that requires community effort and community participation. And this is an aspect that the communities or the citizens don't get to know so much about. So a lot of times health issues are left only for government and healthcare professionals.
Okay.
So through this book, kind to draw attention to roles and responsibilities of citizens. Of course, there's no doubt that we need governments to ensure that our healthcare sector is working. But there are also responsibilities of citizens and communities that if they don't do it, especially in primary healthcare, if they don't perform those duties, no matter what government does, you will not really get value for money. So that's essentially what we try to bring out, looking at the primary healthcare level, which could effectively take care of over 80% of our healthcare needs in this country if it is working optimally. It's high time communities began to know about them and begin to play those roles that is expected of them, while we continue to demand for more investment of government and also more monitoring, supervision, as well as every other action that needs to be done to make sure that our hospitals are working. Yes, everybody must play their part. So in leadership and governance, communities must have health committees and hold themselves and government accountable.
Is it possible to retrace our steps and begin to ask the right questions?
These are the real issues, in the health workers crisis. How do you want to solve it? How do we retain those that we have? So we must create a condition where they will do the job and all their energy and mind be there with minimal distractions. Because caring for life is not a vehicle will break down, you buy a new one, you fix it again and all of that. But life, when it's gone, you can't manufacture another one. So just a second of attention being lost can cost a life.